So the first thing up before we get to our panel is a great story. The most recent child that Gift of Life is taking care of is a little girl from Nigeria. And I spoke about this last night. This is a girl that was operated on 7 years ago through our Metro New York Gift of Life. And a couple of years after that, it was determined she had to return for surgery. But unfortunately, was not able to get a visa to travel. 4 years it took for little Bright to return to the US for surgery and finally get the care that she needed. And as I said last night, I'll repeat today, JT McFadden and his team are responsible for her being here, but it really was JT. And he's going to come up later and we can acknowledge him. But to me, it's an example of why Gift of Life is around for 50 years. People like JT don't give up, they don't relent. They realize the life of a child is so precious. And Dr. Soto spoke about it earlier. You know, how do you say no? How do you not want to go out and help that child? So again, I want to acknowledge JT's efforts, and we have a message from Bright. So let's see Bright's message to us today, if we can.
Good evening. Thank you, Gift of Life, for everything. Thank you for keeping me alive. Thank you for monitoring my health. Thank you. I'm so grateful, and I'm very sure that God will continue to bless you for the good things you have been doing in so many people's lives and my life too. My family is praying for you, and I'm very happy that you are helping me and supporting me through difficult times. I'm so grateful and thank you.
Thank you, JT, for that beautiful, beautiful story and for really saving Bright's life. So this is the next session we have, the final session, but now we're talking about the heartbeat of Gift of Life. The reason why Gift of Life endures and goes from decade to decade to decade. And it all began with this first speaker's Gift of Life program. As I said last night, Frank and I have traveled the world together. We've been to very diverse countries, Ramallah, Kosovo, El Salvador. And in each place, as I watched Frank, something unique he's brought to Gift of Life is that he's gone out and developed support and talent from Europe, especially from Italy. And we've had a number of teams from Italy come with us. We had Dr. Krupi from Bergamo at one time. He used to go to Uganda and El Salvador. And then he found this team from Gaslini. And really, that team has been central to what we did in Haiti and in Kosovo. And they've been to Romania as well. But Frank's heart and soul is in Gift of Life. He now has 3 grandchildren. But I know that every child that we've helped, and I've watched what he's done with the Salvadoran kids, he doesn't let go of the children. When they need help after these surgeries, Frank stays with it. And he's a great example of why Gift of Life has flourished around the world and why we can still call Gift of Life really our family and the family that all of us want to continue to create around this world. And I want to thank Frank. Frank DiMarco, the president of Gift of Life, Inc.
Good afternoon. First of all, thank you, Rob, for this opportunity. And last night was a wonderful gala, and it was very rewarding for me because I happened to see, after many years, some of the friends that we met during all this world traveling. Dr. Francisco from El Salvador and Dr. Guglielmo, Dr. Erika from Bolivia, our friend Lina from Beirut. Like I promised you, I'm going to come under different circumstances this time. I was in Beirut in 1982, and it was a nice vacation that time. So, but I'm looking forward. So, and many other friends. I forgot right now.
You forgot where you are?
One more person. I can see her. Okay. When I see her, I'm gonna acknowledge her. So I've been with Gift of Life since 1997 when I became Rotarian. And today I'm here to tell you a story, a beautiful story. So in fact, every beautiful story starting at once upon a time. So the birth of Gift of Life, you've been here many times during these days. In 1974, a Rotarian from the club, Rotary Club of Manhasset answered a call for help from Uganda. And 5 years old, Grace Aguado, which we happened to hear last night on video, flew to St. Francis Hospital, New York, for a life-saving heart surgery. So, and this success gave birth to a Gift of Life Inc. in 1975, and that's why we celebrated, all of us, a 50th anniversary. Over 50 years later, thousands and thousands of children's lives have been saved because of those pioneers in 1975. Gift of Life Inc., which in this story I will call the mother, he has a timeline of growth. So in 1974, Grace Aguado surgery. In 1975, a Gift of Life was founded. In 1975, of course, St. Francis Hospital has become part of a Gift of Life Inc. And in 2003, thanks to Robbie Dano, which he gave me a business card of Dr. Giancarlo Crupi, I was able to travel to Italy together with Aldo Frustacci and John Blandi from the Verrazzano Rotary Club to do an exploratory trip. And in 2003, Gift of Life Inc. Financed with $50,000 at the inception of Gift of Life International, so Mom gave a birth. Partnership with, in 2005, we signed a partnership with the Ospedale Riuniti of Bergamo, and the first affiliate, it was the first affiliated hospital outside the US. In 2005, we sponsored the first foreign mission in Chisinau, Moldova, with Dr. Giancarlo Crupi. And I remember when at the United Nations, we celebrated the 10,000 child in 2008 altogether. In 2011, a partnership with the Gift of Life International. You know, when you guys starting the art are in El Salvador and a heart are in Uganda. So in El Salvador, I still have a beautiful memories. And Yvonne, yes, I remember Yvonne. It was nice to see you after so many years. In 2012, we did a partnership with the Le Bon du Ver du Corps Hospital in Casablanca, Morocco, which we stays in there from August of 2012 until November 2012. And Dr. Giancarlo Crupi was able to save 60 children during all this mission, one next to another one. So the first mission in Amman was in 2014 with Dr. Giancarlo Crupi. In that, the first mission was at the Jordan University Hospital. And in that occasion, in 2014, I was introduced to the Rotary Club of Amman Cosmopolitan, and of course to the Al-Khalidi Medical Center. And it was the first mission in Amman. In 2016, we signed a partnership with the Gasolini Hospital, like you mentioned before. And I had the pleasure and the honor to have you on mine next to me when we signed that agreement. I want you to be there with me. And so from 2016, after we signed the agreement, I call a big, beautiful partnership with Gift of Life International, an incredible journey from Haiti to Kosovo to Romania to Bolivia to Palestine and Italy. And this was a very, really big, beautiful partnership. So in 2022, we returned in Amman as a partnership with, and in 2025, we just signed a partnership with Ospedale San Vincenzo, Bambin Gesù of Taormina in Sicily. And we are signing an agreement next month with the Ospedale Bambini of Palermo, Italy. So we're going to add 2 more hospitals. So the network grow. Sorry. you can see I'm a little nervous, right? So our achievement on over 50 years, more than 13,500 children was done under the jurisdiction of Gift of Life Inc. Of course, many of these children are part of our partnership. Over 35 international medical missions, and we have over 6 affiliated children's hospitals in USA and worldwide. And this is the visual effect of our journey. So as you see, we have pictures from Haiti, we have pictures from Mount Jordan, we have pictures from Bolivia, and we have pictures when we signed the agreement in Italy. So this is our journey that as a family we've been doing. This is like our family vacation. So there is a picture in the middle when Rob and I were in Ramallah. We proudly took a picture in front of the sign. We say, "We are Ramallah." And as you see in the corner, our dear friend Ari Stein, he was following me one year in Amman, Jordan. So the mother and the child. Why this thing goes back?
The right click.
So Gift of Life Inc., the mother who planted the seeds, nurtured the root, and helped Gift of Life International flourish. Gift of Life International, sorry. Can we go back?
There you go.
The child carried forward the mother mission, saving children's lives across the world. This is the meaning of being part of a family. Mom and child did a lot of medical visits and missions. In El Salvador, we started in 2011, 2013. In Haiti, from 2014 to 2019, before the pandemic. In Kosovo, during the pandemic as well. In Lebanon, we helped sponsor our friend Lina, Gift of Life Beirut, proudly. The money came from the Verrazano Rotary Club, but through Gift of Life. So, and we are very proud of being part of your journey. In Palestine and Ramallah in 2019, in Bolivia, together with Rob and Gift of Life International. In Romania, we did the first mission together in 2019, and then we went back just a few months ago with the Italian team. And in Italy, Bergamo, we brought kids from Uganda and El Salvador, which are still now today they're teenagers, and they're looking for us on Facebook and Instagram. So, and when one of these children, they get, in touch with me, sometimes my wife says, "Who's these children?" I said, "This is one of the many children that I have around the world." So our journey is starting in El Salvador with the Gift of Life International, and here are some of the pictures that I would like to share with in Haiti. And this is also a beautiful picture. I have this picture on one of the weakest part of my heart. And this is in Bolivia. Doctoressa, you remember this, right? So on the top left, this is the moment when we signed the agreement. And like I said, Rob was there. And for many of you, those are going to spill the beans now. So Rob Raymond is 50% Italian. Yes.
Sweet
And-
side.
And I have the proof, because when we were in Genova, I took him to his mother town, which is Alba. Alba is the town of Ferrero. Alba is the town where they invented Nutella. So it was a glorious day. Besides the fact that the Rob was walking in the street of Alba and says, "I'm home." But after that, the most glorious moment was when I had my pappardelle with a shaved white truffle, which is the capital of the white truffle, Alba. So, and here you could see these are the pictures from Genoa, from Ramallah, and the strength of a partnership. Every strong family grows through harmony and discussion, exactly like an Italian family. Gift of Life Inc., the mother, and Gift of Life International, the child, I always kept the mission first, 7 children life. Rob Raymond's leadership as a CEO of Gift of Life International ensured that the child carried the vision, supported on several occasions by the mother. Together, this partnership has brought hope to thousands of children from South America to Europe, from the Middle East to the Caribbean to Central America. Like mother and child, Gift of Life Inc. and Gift of Life International sometimes saw the world differently, many times. But love, respect, and commitment to the children always brought them together. Rob Raymond's dedication allowed the child to grow and expand worldwide, while the mother never stopped guiding, nurturing, and supporting, like a real mother. Despite disagreements, what unites us is greater. A child's smile, a life saved, and the promise that no child will be left behind. You like this picture? This is in Haiti, at the airport. Rob Raymond took a modest $50,000 seeds from the heart of Gift of Life Inc. and transformed it into a global force we know today as a Gift of Life International. What began as a spark became a beacon of hope for thousands of children worldwide. Rob never walked this journey alone. He built it hand to hand with Brenda Small, compassionate doctors, selfless nurses, and tireless volunteers whose dedication made the impossible possible. I count myself fortunate to have witnessed and supported this extraordinary mission. Thank you for allowing me that. Truly, Rob Raymond's work is not just worth of recognition. It deserves an entire Netflix series to capture the magnitude of lives touched and future rereading. 7 children life, one little heart at a time. Gift of Life Inc., a mother, love, a child legacy, a family mission. So if I'm in this mess, it's because of this man here. He was my sponsor in 1997. A few years before I lost my first cousin with our transplant, he didn't make it. So I want to do something in his memory. And I was looking for an organization to do what I need to do for the memory of my cousin. So Aldo, he says, I have the perfect organization for you. So he introduced me to the Verrazano Rotary Club, and right away I joined Gift of Life Inc. in 1997. So my dear Aldo, thank you for being my sponsor and for opening the door that led me to Gift of Life. Your persistence, your devotion to the Verrazano Rotary Club, and your tireless commitment to Gift of Life made you a role model and a true friend. Because of you, I found a path that has become a part of my very soul. A path I believe is my destiny. 7 children life, one little heart at a time. I carry you example in my heart, and I will honor your memory through every child that we save. Thank you, Aldo. Thank you, Rob. Thank you, everybody.
Thank you, Mama. Thank you, Mama.
Thank you, child.
That was beautiful. Thank you. And those are some great memories, those pictures you show up there. We really experienced some wonderful experiences in El Salvador and building that program and with Dr. Krupi. I don't know which one's up next, but as we're waiting for that, I think we're beginning to see how this is not all about one of us, it's about all of us, and how we all come together to make this difference. The flow of today is really ending up here now. We've started, as we remember at the beginning, where we had our partners in country and how that was important to develop sustainability. And then we grew into our like-minded partners who helped to support that sustainability and to grow it even further. And then we heard the last visit from the last session from our healthcare professionals. But now this is the engine that drives it all, are the Gift of Life programs, the autonomous programs that we have 84 around the world. This next presenter is somebody that we met in New York City in a cafe, which was very nice. Had a cup of coffee, and since then, A.C. Peter has been a great friend of mine, but also a great advocate for the children of this world. He will never say no to a request to help a child. We've helped hundreds of kids together from all over this world, from Haiti, from Asia, from Africa, and elsewhere. And so it is my pleasure to introduce to you the director of the Gift of Life India, a true humanitarian, my friend A.C. Peter.
Thank you, Mr. Rob. Mr. Rob, dignitaries on the dais and off the dais. When this young child who came to the stage and spoke, it was reminding me of a girl who came from New York to Delhi in 2014. She said she wanted to do some service for Gift of Life. But the hospital was reluctant to give her any assignment because she was not trained in either of the nursing or anything. But then we requested the hospital, which is the Escort Hospital in Delhi, to give a chance to this young girl who came from New York to work for Gift of Life, at least for a day, because that was her ambition and wish. Finally, the management relented, and she was given the job of pushing the patient on the wheelchair. That is what the hospital could give. But by the end of the day, they noticed her devotion and her commitment, and she got a promotion. And then she stayed there and worked for 5 days. And after the 5th day, she rang me up telling that she has $2,000 with her for her birthday celebrations in a big hotel, but she wanted to donate for the surgery cost of the next child. And we could not take that money because this is a young girl and she wanted to celebrate her birthday. I rang up her mother in New York. Then she said it is her money and she is free to use it. And that changed, of course, our life. And then after a week, one Mr., I am remembering his name, Robert Blocker from Netherlands came to India. He came on business trip. But when he heard about the Gift of Life, he also wanted to see one child. He came, he met the child, spoken to the parents, and then after a week, he came with a check. He said, my mother back in Netherlands is sick. I spoke to my mother about this child and the Gift of Life, and my mother told me, I may die, but another child should get a life when I am no more here. And then he continuously started giving money because of his mother's blessing. We have so many stories which inspires us, and this is, we are not changing their lives, we felt that they are changing our lives, because then we realized we have a mission, we have a purpose in the life. And thanks Gift of Life International, our project when we started in 2000, it was in a very small scale. We could not, as you can see this, Pakistani child crossed the border and came, we had no money. And simultaneously at that particular time, from the other side, the Chinese border, the Assam children came. And when both these children were in Delhi camping for open heart surgery, we had a big problem. But we have managed. But when the Gift of Life joined us, we got vigor and vitality, and the project then really took off. So this is the starting of the point. And when the children left the place, they put up a banner, and you can see hundreds of people. I have not brought all the slides. Hundreds of people from different communities, different walks of life came and wrote their messages. So that was again very touching, and that was covered by all the newspapers, and that got the wider coverage of the gift of life. And we are thankful for the heart gift for supporting through Gift of Life International for 32 children's, African children's surgery. And only one project of the international, we are showing the slides only to give an idea how it is going on. These African children. Our title is Saving Lives and Building Peace. These African children are coming from different nations of Africa to India for their open heart surgery. Many of them don't speak any language, but as I mentioned to my friends here, our nurses, doctors are speaking in their language to them, and the patients, they speak back in their language, but they both understand, and we realize there is still an unknown language which may call mother's language, which they understand, and each other spend their time comfortably. And then when we completed the 10,000 child, it is the Adiniya from Nigeria. That was a very happy occasion for us. And thanks to Gift of Life International, our 10,000 child is your gift. This is the, then again we start counting from 1, 2. While I was leaving India, the Somalia child got operated on September. That date is not given because I was not at that time sure what could be the date, but it is on 2nd or 4th September. So that was the last child. Got operated from this 32. The rest are there, and surgeries will take place. These are the smiling mothers from the same group. And the celebrations were held in 2 places in India of the 10,000 numbers. These are the 3 places. You can see the traditional dance and drum beats were all there as part of the celebrations. Now the Indian children project, which we just recently concluded, I'm not going the slides, but there were 32 in one grant. We have an ambulance stationed in Delhi, which goes to the airport and all around to pick up and drop the child. It is not the title of the vehicle is itself Gift of Life. Now these 2 of them, Grace Aguero and Brett, are also motivators, and they have given us inspiration. This is one of the Ugandan program where the health minister was seeing off the children back to India, and the then ambassador and the health minister and some other officials came to India, and that was when this Ugandan program which we did for Uganda. Our Gift of Life binds India and Uganda for peace. We used to conduct screening camps. There were almost 13, 14 camps were held in different parts of India, starting from the northwest to northeast. These are all tribal and other sectors, where again from one hill people cannot speak to the other hill people. So it's a very complex situation, but camps were held and children were screened and shortlisted, and all of them got there. This is the Dalai Lama, who has sent a child to us for operation from the Tibetan government in exile, and he himself came to meet the doctors and the child. These are the different countries of Africa where we could get children through Gift of Life International, and the left side is the global grants which we have implemented so far, around 35, so that we could do a good number of surgeries. Now, one of the very important part is not only we do the surgeries and the children go back, but we ask them to come back and then there is a reunion. And these 3 slides are one reunion. There are 3 slides because all these children cannot stand in one stage and take one photograph, so we called them in groups. And the governor of the state, the chief minister, the entire cabinet assembled to see these children. And they were reassembled. It was a very happy and joyous occasion for them. And there were parties and celebrations as we did yesterday. Now the project, we are identifying 3 major characteristics. That is, I should just read it out only that much: human touch, element of sacrifice, concern for the less privileged, social justice. Then thanks to the Rotary volunteers, the most important factor is that there has been no administrative cost for our gift of life. It's only the cost of surgery and the airlines, but no administrative cost. And the mortality rate, out of this total 10,000, there were only 2 deaths. So we just said 0 mortality rates. This is a peace project beyond caste, border, creed, region, religion, race, nationality, language, gender, and color. This has been taught by the Gift of Life International to us. Now, I have one request to Mr. Rope. We are completing 50 years and 62,000 surgeries on behalf of these 32 children who are undergoing, and on behalf of all the 62,000 children and the Gift of Life volunteers, we would like to present a small memento to the CEO of Gift of Life on behalf of all the people, all the children, all the communities, and for all the officers and volunteers of Gift of Life International.
Thank you. I'm proud to accept it for them. Oh, look at this. I can keep warm during the winter now. You may all. There will be no living with me. Wow, what do I do with this? Wow. This is amazing. Thank you so much.
Thank you. Thank you.
This is great. Thank you. I'm going to wear this home.
Mr. Rob Railman, midnight I send messages, within second the reply is there. Then I have tested when he is sleeping, 3 o'clock, 5 o'clock, the messages will go in the night. Within seconds it is there. Are you not sleeping, sir?
The computer's on the bed.
Okay, that is why. It is a miracle, a mission, a promise. You are the heartbeat of Rotary Gift of Life.
Thank you. Thank you.
May I request Rotarian Rono Robo to kindly come in, our founder of the Gift of Life. Yes, sir. Rotarian Rono Roby Dono, I met 2000 or something in the convention. Long time ago. And he was one of our inspiration. And thereafter I met Rotarian Rob. It is not just the number of 62,000. Gift of Life International is not measured in years, but in moments. You gave dignity, love, and care to these children, sir. Thank you.
Thank you. Yours is smaller. Just saying.
This is the Indian way of conveying respect, gratitude.
Thank you very much. Thank you. You're really good. I never liked him.
This 32 Children project Ivana Lopez, this lady has done extreme well, did a lot of work for us to coordinate and bringing children and all the small problems she has been looking after, of course, with your guidance and leadership. May I request Ivana Lopez to please come to the stage? Behind every life saved by her and all of us together in our ongoing African Children Project, there is a heroine like you behind working. And we are really thankful to you because the child is given the focus by you. And she is the second mother to all these 32 children. Thank you.
That's beautiful. Yeah, Yvonne.
If the heart gift representative is there, can I request
Why not, you know?
heart gift? Anybody is there? It's not there right now. So thank you, Gift of Life International. We will continue to work. We are an affiliated body to the Gift of Life International. We are together. We are doing the same job. And your inspiration, your support and blessing have been wonderful. And let us all together make this world safer for the CHD children. Thank you, sir.
Thank you. Thank you, AC Peter, and thank you for your commitment and partnership. So our next speaker, I met the first time in the Philippines, maybe?
Yeah.
We did. And Diane is really somebody who shows her emotions very easily, but they are very heartfelt. And I think it's beautiful to watch. She cares so much about our children. Again, it's one of the reasons why Gift of Life is so successful and been around for these many years. It's because of people like Diane. And she's the heart and soul of her program, and she's a great leader of her program. And I'm just very honored to have you speaking with us today. Diane Rotondelli, Gift of Life, Rotary District 7505, South Jersey.
Thank you, Rob. And I am so honored, and I'm already starting to show my emotions here, but I am so honored to be in this room with so many amazing doctors and programs, because without all of you, we don't do what we do, because I can't go do surgeries. I am not allowed in an OR room anymore. I went in once and I got asked to leave, basically. But that's a story for another day. But Rob asked us what our tug was, and I am going to supply my why I stay in Gift of Life and why Gift of Life means so much to me. And really, Mike Colasurdo Sr., he brought the Gift of Life to our district, and he always talked about it. And time wasn't right because I had children, and when it became right for me, I went in 110%. And I have an amazing group of people that I work with. I don't do this alone. And I did go on a medical mission to the Philippines, which that was one of the turning points in my life. I went there. I don't speak Tagalog, but I speak mother. Mm-hmm. And to watch these moms and dads care for their children, to do anything that they can for their children to get these surgeries is amazing. And I would sit outside the OR room and we would just sit there. If they cried, I cried. And trying to give a message to these moms and dads that we're here for them. We're doing what that needs to be done. They didn't speak any English, but they knew Rotary, and they knew Rotary was saving their child. And for me, being part of Rotary all these years and being part of Gift of Life, it just really is heartfelt. And Rob, I don't know where you get your energy from. I don't know what kind of medicines you're on that you constantly go, go, go. Every time I look at Facebook, Rob is somewhere off in the wild blue yonder, but you are the backbone of Gift of Life, because without you, there is no us. And I know every time when we get Arlene and I get a message from Rob, he needs money. So, okay, let's look and see what we're going to do here. But I don't think there's ever a time that we told you no.
Never.
And I don't think we ever will.
Never.
But what really got me was, I don't know if you remember this. Remember when we had a Zoom call with other Gift of Life chair people? And I happened to be on that call. And I will never, ever forget one of the chairs on the call. She was not a chair until after her journey. She had 2 boys that were born, twins, and both boys were born with the same heart defect. One of the boys only lived a couple of days. And she heard about Gift of Life. And she said, I am not going to lose my other child. And she traveled. She picked up her baby and she traveled. And I don't even remember how many hours she traveled to go to Gift of Life where they were doing surgeries. And she said she was not going to leave until she knew her baby would get the surgery. And she begged and she begged and she begged. And when a mother has a determination, or a father, when you want to save your child, you're going to do what you have to do. And I guess after a lot of pleading and stuff, she made a promise to Rob. And she said, if you save my son, I promise you that I will go back to my city, to my country, and I will start a Gift of Life. They saved her son, and she kept her promise, and she runs a very successful Gift of Life program because of you and because of all of the doctors in this room who give selflessly of what you do, and you give back, and you are amazing, amazing people. But that story stays with me all the time because determination is just an epitome of what we all do. And the determination in this room to raise the funds, the monies that you raised last night, so that we can all do more, not me, because you don't want me in the OR, but somebody else in the OR to do those surgeries. You guys are, and women are so, so amazing. And I thank you, Rob, for letting me speak today from the bottom of my heart. Because of you, this changed my life forever. Thank you.
So the mom that Diane is referring to is Habibat from Gambia. And the son was Amadou, and I met them at Boston Children's Hospital. And at the bedside, the mom did turn to me and said, if my child lives, I promise you I will give back and help other children. And in our infinite wisdom of putting these 2 on stage together, 5 of the children in this African project are from the Gambia, and Hobby was responsible for getting them visas and passports and helping them to the airport. Now, she lives in London now. She would fly back to Gambia and be at the airport with the children when they left. And again, this resonates, and I'm going to hate for this weekend to end, because these are the stories that are so special about Gift of Life. This is why you guys keep on coming back. This is why you're sitting here at 3:30 in the afternoon on a Sunday missing all the football games. I know that Chico's not even watching the Cowboy game, so that's pretty good. I'm proud of you, Chico. You're probably winning. But that is why we're here. And I think we have to think about doing this again next year. Not the gala, that was too much. But I think we should do a conference next year because we have more stories to tell. and we have more glory to enjoy together. And I loved your conversation with us, Diane. Thank you. So what we're going to do now is we're going to have these fine presenters exit the stage gracefully. We're going to bring up the next group of presenters. We have Lina, Nael, and Eric. Now this is a group, I got to tell you. We may not be out of here until 4:30. So I'm not talking about you, Eric. So if you could make your way up here very, very, very quietly. Would you like me to help you up here? That's a beautiful jacket. No kissing. So, second to last session of the day, and we're nearing the end of our family reunion here. The diversity on this stage is really remarkable. We have people who've come to Gift of Life in different ways. I first met Lina in 2015. We had dinner in a restaurant in Manhattan. 2014, full disclosure. But Fred Lee was there, so everything was kosher. And we decided then that we would go to Lebanon the next year in September of 2015. Now, what is so memorable to me is while I was away, my dad had a stroke and he died a month later. But I always remember that visit because the energy you put into that was amazing. And then a kid calls me 10 years ago, 8 years ago, whatever it was, and he's a freshman at McGill College in Montreal. Calls me on a Saturday at 8:30 in the morning, and he says, "Hi, Mr. Railman, this is Padam, Musharbash, and I want to start a Gift of Life program in my college. How do I do that?" For an hour, he basically interviewed me, and he went through a whole litany of questions he had for me, and I'm like, this kid's sharp. So we followed up. We developed the Gift of Life program. I started talking to him about Jordan. We want to do some more in Jordan. I need a leader to help me out there. He says, "Oh, my dad," well, he says, "I am too," is Jordanian, and I'd like to introduce you to him. So Farah introduced me to Nael, and Nael and Ruba have been my partners, Gift of Life International's partners, Gift of Life's partners in Amman for the last, how many years is it now? 10 years. The next gentleman is a Filipino. You were going to enjoy tremendously his presentation. He's got a personality larger than this room, and he has a heart as large as this room as well. And Eric Tensuan has been a great partner there. He loves the children. You could see him. I don't know if anybody saw last night the video he does with the hundreds. They had hundreds of Filipino children that were helped, and he was orchestrating them, wishing Gift of Life a happy birthday. So as I tried to delay this long enough to get the next slide up here and allow for us to continue this, the diversity of Gift of Life is coming very clear to you, is it not? I mean, you see presentations from an Italian American, you see presentations from an Indian, you see a presentation from a true American, you see presentations now from a Lebanese, a Jordanian, and a Filipino. Amazing. But we all come together as one, don't we? We all come together, and for that one purpose, to be able to help that next child and to keep on growing this amazing network. Just so you know, we are on a path this year to do, I hazard to say this, last year we did 5,200 kids. We are on a path this year to do over 6,000 children. 6,000 children 1 year. Now, it took us almost 32 years to help 10,000 kids. We celebrated our 10,000th birthday, what was the birthday in 2008? It would have been 33. It took us 33 years to do 10,000 children. In the last 18 years, we have now helped over 50,000 children. And that's because of everybody in this audience. You know, when we talk about our Gift of Life programs, they work so hard to raise the money. And coming together is what has made a difference for us. Being able to come together as one, and you go back to that We Are the World song, to come together as one for the sake of that child is what makes us special. And to take away from here the energy that we have this weekend is what's going to help us get over that 6,000, and someday get to 7, someday get to 8, someday get to 10. And all that is helping more and more children every year. So, Chris, if you're ready with that next week, you can get a presentation for either one of these three. It would be fine. I think any of them would like to Looks like Eric's ready to jump out of his seat over here.
Eric's next, but he only has a video.
Okay. Okay, let me have Eric, would you like to talk before or after would you like to talk during the video?
No, let's start with the video.
Okay, you want the video to speak for itself?
Yes.
Okay.
Because
Okay, thank you, Chris, for explaining that to me. Thanks for...
So, magandang umaga sa inyong lahat. Good morning! Let's be happy. Buhay tayo ngayong umaga at hindi tayo basa.
When I say happy, I say heart, right? Happy heart! Anyway, so this day is thank you. Dahil okay na yung mga bunso ng mga anak ninyo. At hopefully, mas marami pang magiging katulad ninyo.
As of today, almost 63,000 na ang napagamot ng Gift of Life International in 80 countries all over the world. And we are part of it. It's not an individual effort. It's a village effort. Kumbaga, ang buong barangay natin ang tumutulong para sa kapatid.
Your stories are very powerful. So those stories can change the lives of others. Hindi madali maging magulang ang may sakit sa puso. Kayo ang nakakapagsabi niyan. Pero, hindi din biro to have the courage to actually take that step to have them treated.
Hi, mabuhay. So, since some persons earlier stood up, I think I can stand up now. So the way I would do it, mabuhay from the 56-year-old club, the Rotary Club of Makati West with 120 strong members, as well as the 2,418 families whose children have been given a new lease in life through this wonderful thing called the gift of life. So mabuhay means long live. So mabuhay kayong lahat. Long live to all of you. I would usually start my talk by informing the audience that they may not see me, but definitely you will hear me provided you are still awake. Gift of Life was introduced
by the late P.P. Lou del Rosario 21 years ago to several clubs in the Philippines. The Rotary Club of Makati West decided to take on the challenge, which is how and why I am with you this afternoon. In our previous Rotary year of July 2024 to 2025, the Rotary Club Makati West, together with the Rotary Club of Cebu, sponsored a combined 555 open and closed heart surgeries with the assistance of the Gift of Life, TRF, Global Grants, PhilHealth, that's our government institution, as well as private individuals and guarantee letters from public servants from the Philippines, Congress, and Senate. We might be a bit corrupt, but we know where to get the money to make the kids live longer, especially during election year, all right? Does that sound familiar? All right. Anyway, while 555 procedures is considerable accomplishment, we realize that even more could be done. So now it is my belief that the joint philosophy of the Rotary and the Gift of Life program is very simple. First, we believe in an idea. Second, we focus on achieving that belief, and we see it manifested through results. We share ideas, expertise, and resources in such a way that the Gift of Life has crossed oceans. In Manila, then we expanded it to Cebu through Rob and the late Lou del Rosario, who started that. So then we have to inspire others and ourselves to do more. We celebrate, as we did last night, as we fulfill our purpose. There are now, if I may have your attention, please. There are 3 initiatives I will share with you today, all brought by the inspiration that is the Gift of Life. Jaden and Friends was a brainchild of Janice Lopez, a mother with a child with Down syndrome, who underwent PDA surgery in 2017. Out of gratitude, just like the other story we heard earlier, she organized a group of mothers whose children faced similar challenges and were given the opportunity to receive free heart procedure. Their efforts were magnified, and this was when I was the president of our Rotary Club on its 50th year, during COVID, when they decided to be angels of the children undergoing similar procedures. They would relieve the parents from watching their children during long hospital stay so that the parents could take a short break or do personal chores or spiritual and moral support, and even arrange homestays for families who came from outside the city. So though COVID was there, for that year we were still able to do close to 113 procedures. We never said we will accept defeat. We kept on the fight, we kept on the fire. Janice was inspired, and now she inspires all of us. Another initiative was the Guardian Angel program, was an initiative by my friend Pipi Rocket Tordesillas, who is also from the same Rotary Club of Makati West. The Guardian Angel program was created to make sure that each child who has undergone surgery has means to come back to the hospital for checkups and follow-up treatment. The Guardian Angel program is expected, let's say I'm a guardian angel of 1 or 2 kids, is expected to check on the child's progress and to provide any assistance that the angel sees as necessary and appropriate. Already, we are proud that some of our children have grown up to be successful professionals among our undersecretaries in our government institutions and some CPAs in private practice. The third initiative involves government medical assistance, which augments donations we receive from Gift of Life International, the TRF Global Grants, and private individuals. Our very own Congressman, he's a PE, Paul Daza, a member of Congress, and RC Makati West, has allotted close to $800,000 for pre and post checkups. So that's very important for our Gift of Life operation. It truly takes an entire village to make a belief achievable. One that must be shared to inspire the next generation to even greater heights. I, for one, have experienced this journey personally. 15 years ago, my own son underwent a procedure, a heart procedure. I know what it feels when one enters the operating room. All bets are off. In that moment, everyone is in equal footing. Lastly, I would just want to share some quotes. I love watching the movies. If you have ever seen Braveheart, there is a saying there that all men die, but not all men live. In The Last Samurai, when the captain offered the sword of the samurai to the emperor told him, "Tell me how he died." And he responded, "I will tell you how he lived." I am very humbled to be amongst you today. I believe that we in this conference live for the gift of life. Am I correct? That sounded people's. All right, anyway. May I now ask you to join me in a chant that I experienced when I watch a college football game. Can we all stand, please? If those who can, please. Though this gentleman is no longer that popular, but the chant is very popular, which I use during Rotary meetings, every Rotary meeting, and family meetings. When I say we are, you say gift of life. When I say you are, you say gift of life. All right? So let's try. We are. You are. Good afternoon and mabuhay kayong lahat. Thank you.
Thank you, Eric. That was wonderful. Appreciated that. I think you can see where Eric is a great motivator for our program back in Manila and really has had a great impact on that program. We have two more on this session, and again, our time together is coming to an end, but I think that we're going to take this weekend with us, and I hope it stays with you as long as I know it's going to stay with me. I think that this is going to be inspiring for the future. I hope we've maybe made some connections where we can work together in a greater good than we have in the past. And you've seen the best of the best that we've had up here. I'm waiting very anxiously to hear what Lina and Niall have to say. Do they both have PowerPoints, I think, right? Correct? Okay. Anybody have a question so far for anybody that's spoken the last four presenters? Anybody have a quick question out there for one of the last four presenters? Okay. Emma, you raising your hand? Emma, did you raise your hand? No? Okay. Beating against all odds. So I wouldn't have to see I wouldn't even have to look to see that was Lina's presentation. From the day that Lina started and the excitement she had when we first met for that dinner in 2014, you could tell that we were going to change the direction of how pediatric cardiac care was going in Lebanon. And Lina has done that. Anybody who's on Facebook and watches her posts, she has exploded the pediatric cardiac care in that country and allowed for children who never would have had this care before to be helped. She's now working to identify children that are not going to the doctors, they're going out to remote locations and identifying children with heart disease. Very innovative, very inspiring, motivational, a great woman. Lina Sheyeheb.
It's working. Hello. It's working. Okay. I'm very happy to be here. And this is a great honor for me to be part of this gathering this weekend. Thank you, Rob. We met 14 years ago because, no, that wasn't 14 years ago. It was 11 years ago because I was living in New York and had to go back to Lebanon because my mom got sick with a rare progressive muscular atrophy disease. So she had 3 years to live. And I thought, what am I gonna do? I have to bring something with me to Lebanon. So I knew Fred Lee and Rob, and we went and had dinner, and I told them, you know what, give me like few months, I'm gonna go to Lebanon and check the situation and see how I can bring this program to Lebanon. And I remember you asked me how many surgeries you think you can do there. And I said, after I came back, like a few months later, and I said, maybe 25. And you said, are you crazy? I don't think you're gonna be able to have more than 5 surgeries. Let's put it this way. The first year, we had 40 surgeries. The next year, we had 100 surgeries. The year after, 100 surgeries. Until COVID hit, and we were not able to continue the way we started. You gave me 24 hours to put together a presentation, a PowerPoint, so I just threw in some pictures. I'm gonna speak, and you're gonna look at the pictures and see what I'm talking about, okay? So the birth of Gift of Life happened in September 2015. Does this ring a bell? It's our anniversary, 10th anniversary.
Yep.
We believe that 2 very important aspects of Gift of Life Lebanon made Gift of Life what it is right now. Number 1, it's its partners. And number 2, it's its program. So our life-saving partners are many, but I'm going to talk about the main ones. AUBMC, the American University of Beirut Medical Center, our UN partners, our Riley Hospital partners, Hamoud Hospital in Lebanon, and of course, Rotary. On our first grant that we did, we were able to gather 20 clubs. I went to each and every club, 30 clubs in Lebanon, walked in and gave them a presentation about Gift of Life. At that time, in 2015, no one knew what Gift of Life was in Lebanon. It was probably in a lot of countries like Jordan and other countries, but in Lebanon, it was something completely new. But within a year, I had 20 of these clubs come in and give money for a grant to Gift of Life Lebanon. But what made it happen is really our Rotary partners in the United States and how much they believed in me and Gift of Life Lebanon and helped us with these surgeries and helping these kids. So not only did I go to Rotary clubs, I went to Rotaract clubs, Interact clubs, Inner Wheelers down there. The picture shows here every aspect of Rotary was partners with us. The second thing was our programs. So we did not stop at we did not stop at just doing grants and saving lives, no. We went the extra mile to involve our community and do programs that involved everybody. The pictures that you see up there is the blind and deaf school in Lebanon. And it was the blind and deaf school that did a concert for Gift of Life to save children with heart disease. And in return, we went and had a program for them to help save the blind and deaf kids. You know, this year I was so, proud when all Rotary clubs in Lebanon came together to run to save a life with Gift of Life. So they run to save a heart. Every single Rotary club in Lebanon was involved in the Beirut Marathon, and they ran to save a children's heart. We have our Christmas concert. We have many, many programs. Actually, I brought into Lebanon the head judge, the senior judge of The Voice, the program The Voice France, to Lebanon under the name of Gift of Life to get kids to come in and sing. And we sent a couple of children to Paris to sing, in The Voice. So one of our programs and our healing missions is, I thought, okay, we have these kids that we're helping, but how about the kids that don't know that they have heart disease? How about the kids that can't see a doctor? So we created a program called Prevention and Awareness Campaign. Prevention, so we can prevent the disease from growing and surgeries being more complicated later on. So we decided to take doctors with us and go to areas in Lebanon and partner with several people. Like here, we have the Order of Malta partnering with us, the Red Cross partnering with us, the UN partnering with us. So we really work in partnerships to be able to grow our mission and to get there somewhere. So we did 6 missions in Lebanon where we took with us 60 doctors, over 100 volunteers from Rotaract and Interact, and we spent 2 nights in remote areas in Lebanon where we checked 1,000 kids each time. Out of these 1,000 kids, it was a full checkup. So we had pediatricians come with us, we had dentists come with us, eye doctors come with us. These kids had a full physical checkup, and of course our heart screenings. We had disposable heart screenings, and the Children's Heart Center from the American Hospital came with us. So out of the 1,000 that we checked each and every time, we would find about 25 children with heart problems, but at least 10 to 12 children did not even know that they had heart problems. So this is what I call really saving a life, because these kids would have died without knowing that they have a heart problem. So we went to them, we went to their area, we found them, we screened them, and we treated them. And this was very important to us and our mission that made us a little bit different maybe than other missions. Another thing is the awareness campaign. So every time we went on these trips, we had an awareness campaigns for mothers. First of all, we gathered them and we talked about heart problems so they will know what to see in their kids. If your son or daughter is not eating well, if the baby is not behaving the normal way, if the little toddler is tired going up and down the stairs, it's not because he's spoiled and doesn't want to play. He might have a heart problem. If he is a little bit dark and getting blue, it's, he's not dark like his grandfather. He might have a problem. So we talk with them and we give them the opportunity to talk to a dozen of other doctors, gynecologists, psychologists, all of these people. This is the support that we give to mothers of children with sick children. So we do have a beautiful committee. And everybody loves Rob, so every time he comes to Lebanon, he's been there I don't know how many times. You know, everybody gets so excited about being with Rob and doing stuff with, with Rob. So our committee in action is, we in Lebanon have had a challenging political situation, as everybody knows. So we decided to create a program called Emergency Relief Program. And here what I did is I tried to get companies that do products for kids so we can help, firstly, our patients, and secondly, other children that might be sick around Lebanon. So we distributed Pampers, we distributed Always for their mother, we distributed the first picture that you see down there is at my place, at my home. This is how it started. I collected a few $1,000s and I started distributing, you know, soap and, you know, toys and whatever we could to the children. And then it grew and we were able to help 50,000 families through our emergency relief program. Am I doing the same thing he did? Okay, here. Okay. So this is the emergency relief program, and as you see, you know, I have all of these people going around to hospitals and helping children that are sick and distributing, you know, babies and, you know, Pampers and everything they need. Here. Okay. Another program that is very important to my heart is engaging the youth, engaging schools. We've been going to schools, talking to students, and telling them about how to be a humanitarian. As we all know, when we join Gift of Life, we become addicted. And I wanted these kids to be addicted to Gift of Life and being humanitarians. So they were so addicted that they won one of the schools, worked all year round, baking, selling, collecting things and selling them to save the life of a child. They raised money and we saved the life of a child. This school happened to be part of the French embassy in Lebanon. When the French ambassador found out about it, actually I sent him something on the side and he saw it. He talked to the French government and they gave them l'Ordre du Mérite, which is the highest award French government would give to outside of France. So these kids, you know, down here that worked so hard to save the life of a child got to get an award from the French government in Lebanon through Gift of Life, absolutely. So here we see the kids, what they're doing, you know, Christmas gifts. They had a program called, you know, the Bears of Gift of Life. They do breakfast, they bake. This is the scouts down there, you know, also doing programs to save a life. Down there, this is another school. So this is what we have been also doing, you know, engaging the next generation, teaching them about being humanitarian so they can take our place when we're gone. Another program that was extremely successful in Lebanon was a program we called I Saved a Life with Gift of Life. And this really put Gift of Life on the map. You know, I've talked about Gift of Life on TV, on radio, but it wasn't me that made Gift of Life really, really famous in Lebanon. If you say Gift of Life in Lebanon, people know that there is an organization called Gift of Life that saves hearts. It's because of famous people that we brought in. We brought in singers, we brought in actors, famous faces to the hospital. And we said, okay, we want you to promote Gift of Life and we're gonna do a surgery in your name. So this is what really put Gift of Life on the map in Lebanon. You know, these famous people, Miss Lebanon over every single year, you know, singers, dancers that are known in Lebanon came in and helped us promote the name of Gift of Life. During this time, we also got some awards. This award is from Gift of Life International, the first one that you see with Rob here. And that was,
That little restaurant we went to. That.
yes, the fastest growing chapter in the world.
Yes, that's right.
So you gave us an award. The second one is from the UN, and it's from UN Volunteering Day, and Gift of Life Lebanon won the award of the UN Volunteering Day. And many, many, many other awards. This is UNHCR in New York, if you remember. This is, I was also, I was also part of, I was nominated to win an award from the I think it was change makers, international change makers in Lebanon. Okay, so here we go. Okay. So this is the I Saved a Life with Gift of Life. These are some of our patients and visitors coming to see them. Our patients' smiles. We keep in touch with our patients. So we talk to their families. They have their number, our number. They call us once in a while. So we keep on, we keep track of what we do, and we try to really make them feel as we are one big family, and I think they do. So after 10 years, our achievements are 500 pediatric cardiac surgeries, 5,200 free medical physical checkups, and 50,000 families helped through our emergency relief program. And it's all thanks to all of you sitting here. I can't name everyone, but I love you all, and thank you for your partnership.
Thank you, Lina.
And I also want to, just mention Chain of Hope London and your support always. Every time we had a mission, you came and you said, okay, we're going to be with you and we're going to support a couple of kids. Thank you so much for being
Lina.
there.
Okay, our last speaker, I'm going to have you come up here, Bill, please. Bill Pickens. And you can take my chair here. So Mr. Pickens, we already introduced earlier, is the founder of our Gift of Life MidSouth in Memphis, Tennessee. And he really has been a great advocate for the children of the world, bringing them to Memphis for surgery. And he is really one of the rare programs now that continues to have a relationship with the hospital so strong that they take 10 to 12 a year. So as we're waiting for Niall, I mentioned to you how Niall got introduced to Gift of Life, and his history with Gift of Life goes back to being the president of Gift of Life Amman for, was it 4 or 6 years? 5 years. And he really transformed that program. Dr. Turrentine had met with me years ago and said, we really need some infusion of some energy with Gift of Life Amman, and that's exactly what Niall and his wife Ruba had done, and really changed the course. And subsequently, Niall has gone and formed a Gift of Life International Jordan program, and our main focus is the development of a sustainable program at the Jordan University Hospital. Now, let's talk about why that's important. There's currently one in the great country of Jordan. There's one pediatric cardiac surgeon who is near retirement. And we feel the need that we have to move forward and develop a program that's a public option for the children of this country. And on our board of directors, we have Dr. Harm Velvis, who had a relationship with somebody who knew and went to school with the King of Jordan and set up a meeting with His Majesty. And we met with His Majesty, and he put us on a course to develop this program. So now, without further ado, my dear friend, who I hope you forgive me, Niall Musharbash. Yes, please.
Thank you.
Lo siento.
Good evening, everyone. I am Niall Musharbash from Gift of Life International Jordan. You came at a time when everything felt hopeless and made our dream come true. This is Muhammad's mother. These words are the reason I am here today, to advocate for every child with congenital heart disease and to ensure no parent ever feels helpless. Gift of Life Jordan is a proud chapter of the Global Gift of Life International Network, dedicated to transforming the lives of children born with congenital heart disease. Since its establishment, Gift of Life Jordan has been a light of hope, providing life-saving care not only for Jordanian children, but also to children of all nationalities living in Jordan and the region. We support families emotionally throughout their journey, while also training local medical teams, both during missions and afterward, to build a sustainable heart care program in Jordan. Globally, 1 in every 100 children is born with congenital heart disease. In Jordan, the number is even higher. It's 1.2 in every 100 babies. These statistics are based on a publication issued by the Jordan University Hospital, reflecting the accumulated number of cases in Jordan. Our vision is simple, yet powerful, which is a future where every child has access to the heart care they need, free of financial or social barriers. Our mission is to secure the future of heart care in Jordan through a sustainable, locally empowered program. What we do goes far beyond surgeries. We do medical treatments, community outreach, capacity building, and sustainability. Our focus is to make sure that every child has access to care, not just today, but also tomorrow. We are honored to collaborate with highly skilled professionals from Gift of Life International, Chain of Hope London, and the Jordan University Hospital. Dr. Iyad Al-Ammouri from Jordan University Hospital, Professor Victor Tsang from Chain of Hope London, and Dr. Ganama, Dr. Starnes, Dr. Absi, Dr. Boston, and Dr. Pierre, all from Gift of Life International. The children you see here come from different parts of the world. Each was referred to Gift of Life Jordan. Thanks to Rob and to our global network, we are able to connect with other chapters and help children receive care, whether in Jordan or in their homeland. In Jordan, we have a saying, one hand can't clap. Our strength lies in unity. By collaborating with partners who share our goals, we multiply our impact and bring healing to more children. Since 2016, more than 450 children in Jordan have received the Gift of Life in 31 missions and through individual procedures. Last May, on Jordan's 79th Independence Day, Gift of Life Jordan was honored by His Majesty King Abdullah II with a second-degree Medal of Excellence in the presence of Crown Prince Hussein. This recognition is a national honor that reflects the importance of our mission. It is a tribute to the children we serve, the families we support, and the tireless efforts of our medical teams and partners. At Gift of Life Jordan, every number is more than a statistic. It is a child, a family, and a future restored. Together with your support, we can ensure that no child is left behind and every heart has the chance to beat strong. I would like to thank you all, and special thanks to my friend Rob, who support us for 10 years with continuous support. And also thanks to Emma from Chain of Hope also for supporting us also for the same 10 years, who Rob introduced Emma and Chain of Hope to us in 2016. Thank you all.
That was great, Niall. Very appreciated. And I think everybody can see why we're going to have success in Jordan. We will have a sustainable program at Jordan University. So last but not least, and certainly not least, Bill Pickens, as I said before, Gift of Life MidSouth, founder of it, has developed a relationship with the hospital and continued to maintain that relationship, which is not easy in this day and age. So Bill, the stage is yours.
Good song. Good afternoon. I'm Bill Pickens from Memphis, Tennessee, home of Elvis, Memphis Barbecue, and Lebanon Children's Hospital.
Only on 5 tonight, we're taking you inside the office.
We're going to watch this first. Go.
Was heart repaired by a dream team of Memphis doctors. Joe Burgess was given rare access to an all-female surgical team performing miracles inside a state-of-the-art facility in the heart of the city.
His name is Yazid Gonzalez. These images show Yazid, his mother Yamilka, and nurse Isamar arriving at Memphis International August 4th. Mid-South Rotary Gift of Life treated their guests to fun fit for a 5-year-old, burgers, playgrounds, and popsicles.
And she says he's a little boy with a lot of energy, and he loves superheroes and cars and those things.
Yamilka, her husband, and 2 other children noticed Yazid looked different when he played hard. At age 2, doctors in Panama shared their diagnosis: congenital heart defects.
When he runs, he gets tired, and sometimes when he cries a lot, it looks like the lips are purple or blue.
Cardiologists say children with Yazid's heart defects generally need surgery in the first year of life. Yazid is 5, and he's finally receiving the life-saving surgery he needs at Lebanon Children's Hospital.
We just got through doing the Rotary International Grant. Today we're bringing 6 kids from Panama in the next year to Lebanon for heart surgery. That's the same one.
Lebanon Dr. Danielle Gottlieb-Sen serves as one of 22 women congenital heart surgeons in America. Before operating on Yazid, she had a
Should have worn the habit that in there.
It's just a matter of taking time and using language that all families can understand. She said that they understand that the doctors these days, the surgeon comes to us and explains the background.
The kind of intimacy that we have with families around their children is probably the greatest honor that somebody could have, and it was then worth 20 years of training to be able to do it.
With little Yazid and his family prepped on August 12th, we put on scrubs and stepped inside one of Lebanon's state-of-the-art operating rooms to watch as an all-female surgical team led by Dr. Gottlieb-Sen performed a 4-part procedure in near silence over 5.5 hours.
We need to time on people in their sort of stations and positions around the room to be able to understand what we're asking and also sometimes intuit or preemptively anticipate what we might need or what we do.
Inside the operating room, nurse Jessica Fowler gave us insights through her mask on how the surgical first assistant Valerie, the black headscarf, knew exactly what to do next.
She had to woman surgeries herself and realign the surgeon to hand her stuff a lot of times about
the team here is part of Lebanon's state-of-the-art Pediatric Heart Institute, staffed with specialists.
There's so many things that we do here that are unique, even around the country. Okay, virtual reality, which you see in kind of the screen behind me. We have We're one of the first centers in the country that will perform heart caths in the MRI suite.
Dr. Jason Johnson serves as co-director of the Institute, overseeing an expansion in heart care for children.
So the expansion of 17 new cardiovascular intensive care beds and 14 cardiac care beds or a step-down unit allows us to just care for more patients.
Like Yazid, who is Rotary Gift of Life patient number 120 since 2007.
Wow.
Back in surgery, the anesthesiologist and his nurse anesthetist kept careful watch on Yazid's sedation as the surgeon displayed her unique skill set. So she's literally working her way around the beating heart, right?
Yeah, that's why we're the best. She's gonna keep the heart beating as much as she can, and then once they get to a point where they can't do anything else, they'll have her inject medicines and they'll stop the heart, and then that's when they'll open up the heart and do repairs on the inside.
Once they stopped Yazid's heart, trained physiologists on the perfusion team took over the circulation of blood through his body, keeping his tissues and organs functioning, even though his heart was stopped.
So when it's still, she can really get in there and do precise suturing and precise repairs that you can't do with moving. Doing what I do, that it really is a privilege to be able to work with a team and be able to be in that leadership role, and I take it very, very humbly to be able to do that and get paid to do it.
Exactly 2 weeks after his open heart surgery, Yazid seemed totally recharged at the Children's Museum of Memphis.
It's truly very emotional because he's returned to his normal. He's an active child, and I'm very happy to see him better.
Okay, now as Jennifer was reporting, Rotary Gift of Life MidSouth is solely devoted to raising funds for children like Yazzie who need to be brought to Memphis from anywhere in the world to receive life-saving heart surgery. You can learn more about this program and the Rotary Gift of Life Gala coming up Friday, October 3rd at the FedEx Event Center by going to our website, actionspa.com.
Nice, very nice.
I want a show of hands. How many of you in this room believe in coincidences? Raise your hand. You believe in coincidence? I'm not part of that. I believe that everything happens for a reason. I'll give you a couple of examples. I had a business coach about 25 years ago, and I asked him, I said, what can I do to improve my business, to take my business to the next level? He said, if you really want to be successful, find a project that's bigger than you are. I said, what are you talking about? He said, find a project that you can be a part of, that you can do something for somebody that can't do anything in return. And so he suggested Rotary. So I joined the Rotary Club, and I was involved in several projects along the way. And I was at a business forum in West Virginia, and I'm sitting at a table with a guy that also worked for the same firm. And we started talking a little bit, and something seemed a little funny, and I said, can I ask you a question? He said, yeah. I said, are you a Rotarian? He said, yes, I am. And I said, well, so am I. And his name was Marty Diamond. He lives up in New Jersey somewhere. Some of you may know him. But he introduced me to Gift of Life. And I got to meet Bill Curry and Robbie Dono, and we set up our program with the idea to go approach Lebanon Children's Hospital, which has an unbelievable heart program. And so we got an appointment with Mary Armour, who is the new CEO that had just moved here from Cleveland. And we were told she was there to build this new hospital, probably wasn't interested in our best new idea. So we sat down with her, and she said, what do you want to do? And I said, well, we want to bring kids in from around the world to have heart surgery here at Lebanon. And she looked at me, she said, well, okay. And I got real scared. I said, I thought I was a pretty good salesman, but I didn't think I was that good. I said, let me go back over this again. We want to bring kids in from around the world that have heart conditions and want you to operate on them for almost nothing. And she looked at me, she says, can't you take yes for an answer? Well, what I found out was that she had run a Gift of Life program in Ohio before she came to Memphis. She knew more about the program that I was trying to sell her on than I did. So I said, yes, ma'am. So that we formed a great partnership with Lebanon, and we've it's just done nothing but grown, and it's just been a wonderful experience, a wonderful life experience for me. But I have two granddaughters. One's a step granddaughter, but my granddaughter, who just is a freshman in college this year, she's been working with the program since she was 7 years old. She's had her school make get well cards. She's gone with me to the hospital and entertained the babies and all this stuff. And so she's been great. But my other granddaughter, this was won by marriage, my daughter's marriage, and her name is Kelsey. Kelsey has Down syndrome, and a number of these kids that we've taken care of have Down syndrome. So I happened to see her one day, and I noticed that I saw the top of a scar. So I asked her dad, I said, what is that? She said, well, she had heart surgery at Lebanon when she was 7 months old. Now, Kelsey's very functional for somebody with Downs, but she wants to be so involved with Gift of Life. Every time we have a family that has a child with Downs, she says, I'm going to go see them. So she interacts. She doesn't see her Downs as a negative, but she is just so happy to get involved and meet these families, these children, and love on them. But there's another hidden message in there, too. Another coincidence is that I'm sorry, I lost my train of thought over there, but Kelsey is, the interaction that the Kelsey has with the mothers of these children, you know, they're here and they're worried about whether their child's going to survive surgery, number one. But number two, where's my child going to be 10, 20 years from now? They see Kelsey as a 32-year-old child, survivor of heart surgery and Down syndrome. My child has a chance. So that's just a win-win situation for everybody. So this has been the best experience of my life, and I can't get back. We just started a grant, a Rotary grant with Panama Canal, and this child that you just saw in there just went home yesterday, Friday morning. It's today's Sunday, yeah, Friday morning. And so we've got 5 more coming behind him, and we're also working with some people in Jamaica. And so, you know, the program goes on, and we've got 2 new surgeons that just came from Johns Hopkins, the lady that you just met in here. So it's a wonderful thing, and I'm just so happy to be a Rotarian, and that's why I don't believe in coincidences.
You're great, Bill.
Okay.
Great job. God bless you. Sit and take a seat. So, excuse my back here. We are, and can we turn the lights up, please? We're at the end of this amazing weekend, and we couldn't have ended it on a better note than we just got here. Is Caitlin, Jackie, and Yvonne in the room? Caitlin, you're here. Is Yvonne here? Jackie, you here yet? Hi, Jax. Do we know where Yvonne is? So, first of all, thank everybody for staying through the day. It's been a long day, but I think it's been an impactful day. And I do hope that you go forth here and we get just re-inspired and we continue to work together and make what we do very special. Something I didn't do last night, I was reminded of, but I'm going to do right now, is to say thank you to people who made this possible, because it wasn't just me, that's for sure. Brenda Small, who you know very well. Brenda's on vacation this week, and she was really very instrumental in putting a lot of this together. Jackie, can you start walking up here for a second? And Yvonne and Caitlin, who you guys got to, Yvonne, don't applaud for her yet. Yvonne and Caitlin, who you got to know very well throughout the week. You guys were amazing. You've never done this before, and you did it so, so well, Jax. And my partner for the last 9 years, and somebody who, if Jackie didn't get involved, come here. If Jackie didn't get involved in this weekend, If Jackie didn't get involved in this weekend, it never would have happened. I should have done this last night. Jackie is an amazing human being, and we should thank her. So that's my personal note for the day. Go forth, do good, and let's help that next kid. God bless you.